Hi all, my name is Shayne. I'm a physiotherapist here at Back In Motion Brighton, and today I would like to talk to you about the GLA program. So before we jump into what exactly the GLA program is, I want to talk a little bit about osteoarthritis because it is very common and most people have an idea of what it is. We all know someone who has osteoarthritis, and quite often what we hear them say is that it's bone on bone or wear and tear, or it's just getting older, that's all it is, it's unavoidable. However, all of these sayings have negative fear-related connotations and none of them are entirely correct. Our medical system is built to fix the issue once we have it. It is reactive, it's not very proactive. And what this means is people seek out a diagnosis for their pain or their condition as they want to know what is truly wrong. However, all they get is the label. They don't fully understand what is happening inside the body. Osteoarthritis is a diagnosis that one can receive based on a variety of symptoms and factors that could affect them. It is a condition that affects the whole joint, not just the cartilage or the bone, as most people believe. And contrary to popular belief, rest actually makes it worse. So with treatment of osteoarthritis, it should always be what is called evidence-based. This means that the treatment provided should be based off of the most recent good quality studies that are completed across the world every day. What this best evidence research has shown, particularly for hip and knee osteoarthritis, is that a combination of education and exercise can provide some long-term benefits for those suffering with osteoarthritis. We should always have a look at contributing factors as well. So these play a role in the pain that you are feeling. Contributing factors could be issues in other joints, your lifestyle, or psychological issues such as stress. The biggest thing to understand is that the management is the most important factor for long-term benefit. Now, management does not mean management by health professionals. We are talking about self-management, the management from you. So popping up onto your screen now should be what is called our treatment pyramid. So down the bottom in the green is what's called our first line treatments. Okay, so these are the treatments that we recommend everyone experiencing hip or knee osteoarthritis complete. This is education, exercise, and weight control. So all of these, everyone with hip or knee osteoarthritis should be completing. However, if that does not then manage your pain, we then move up to the second tier. And these could be such things as medication, walking aids, more physiotherapy, orthotics, ice packs even come into here. However, if you move up a tier, it doesn't always mean that you stop doing your first tier. You should always continue to do that first things, which are education, exercise, and weight control. You just sprinkle a few added things on top. Then, only then, if the first two tiers don't control your symptoms enough, then we should have a look and consider surgery. There are common treatments for osteoarthritis which are no longer recommended by best research evidence for long-term benefits. These include most medications as well as injections like cortisones. Quite often we also miss addressing contributing factors such as biomechanics, which can then affect your efficiency of having reduced symptoms for the long term. Now, biomechanics is the study of determining whether or not a body is moving in the most efficient way possible. There are 4 evidence-based treatment options for osteoarthritis, and these are education, exercise, weight control, and activity. I just want to pause there and have a bit more of a chat about surgery. So there is a history of premature surgery regarding knee and hip osteoarthritis, mainly due to the lack of knowledge in other conservative treatments. However, we now know that with most osteoarthritic symptoms, we can control the progression of the osteoarthritis without the need for surgery. Surgery should only be offered if all other treatments have not worked. In particular, one surgery is an arthroscopy. So current evidence shows that there is no benefit for those with osteoarthritis in reducing their pain compared to a placebo if you have an arthroscopy. In fact, osteoarthritic guidelines from around the world recommend against this procedure. Okay, moving on to what you're all here for. What is GLAD? So, GLAD stands for Good Life with Osteoarthritis Denmark. It is a research-proven education and exercise program for those with hip and knee osteoarthritis. It incorporates the most recent evidence into a nicely structured program to give you long-term lasting benefits. So here at Back In Motion, we run the program multiple times throughout the year at varying times. It is a 7-week program where we see each other twice a week to teach you the skills you need for self-management. The appointment structure is as follows. So we require you to have what is called an initial extended consultation. This is where over an hour we get to know each other, we complete an assessment of the problematic joint, and I teach you all the exercises required for the program. Then we move into our 2 education sessions. So these sessions are most important because it gives you the knowledge of how to self-manage for the long term. It will teach you how much pain is too much, why we are doing specific types of exercises, what to do if you're coming up against barriers against exercise that you need to overcome to be able to continue on. This is all very important because we want you to continue this exercise and education after you finish the program itself. Then we move into 2 exercise sessions for 6 weeks. And this allows us to slowly progress you through different levels of exercises to get you the most benefit for your goals. Then, after the 6 weeks of exercise sessions, you're free to go. So you head off on your own, you continue doing the exercises at home, but you can always give us a call if you need. Now, our 3-month standard consult is held 3 months after your first exercise session. And in this session, we review your goals, we see how far you've come, we make new goals, we do some more assessments to make sure that you are continuing to progress and not just staying stagnant where you are. GLAD exercises are a specific type of exercise called neuromuscular exercise, and coupled with education, they are wonderfully effective in reducing pain. Participants from around the globe experience less pain and have better physical function for a better quality of life, and all for a less hassle than a replacement surgery. Here at Back In Motion Brighton, we focus on the cause of the pain and not just slapping a band-aid on for pain relief. Our goal is optimal long life health, addressing the cause of the symptoms rather than just treating the symptoms as they are. If we address the cause of the symptoms, quite often we are able to prevent any reoccurrence and control the symptoms to allow the individual to continue on and live their life as they want. Of course, everyone is a little bit different, so we have to treat everyone a little bit differently. We have what works for the general population, but we might just have to tweak it here and now for each person. This means that people in the GLAD program, while they are doing similar exercises, they progress at different rates, and some might even have a little bit of extra homework to continue to achieve their goals. Some common questions that we receive are, how does the exercise benefit cartilage? Is it okay to exercise if it hurts? And will the benefits cease if I stop? These questions and many others are addressed in the education sessions you have before you start the exercises, and they give you the knowledge to manage your own symptoms. 2 other frequently asked questions I would like to address today. The first one is, what if I haven't been physically active in the past? My answer, perfect time to start. It is never too late, and best time is now. We can start off slowly to build your love for exercising and help make it part of your new lifestyle. Second question I'd like to talk about is, I've tried exercise in the past and it didn't help. What makes this different? So I'd like to throw another question off to you, would be, what type of exercise did you do? There are many different types of exercises, and quite often when we get told to exercise, we go out and we walk, and sometimes that is aggravating to people. So these exercises are generated, so they're a bit different, to focus on osteoarthritic joints in particular. And if you don't do them properly, then yes, they can flare you up. The GLAD program is a little bit different because it is directed by trained physios and is proven to reduce pain. So if you're interested about learning more about the GLAD program, feel free to contact us here at Back In Motion Brighton on 8296 1755, or you could always flick us an email as well. So we are always here to help, and we look forward to answering all your questions.